I'm presenting a case of routine manual phacoemulsification performed at Provel 8. The first step is a 1 mm side part. After that, I pressurize the anterior chamber with dispersive viscoelastic. I prefer to create a self-sealing 2.4 mm clear cornel incision, followed by the roundest possible capsular rhexis, typically around 5 mm. These steps of the surgery requires an excellent visualization with the best red reflex. The microscope is very capable in this requirement, allowing an incredible reflex, even after hydrodissection. The next steps are hydrodissection, hydrodelineation, and nucleus rotation. In this case, I use the phaco chop technique, followed by 4 quadrants phacoemulsification. I like to use a phaco machine with Venturi pump. That speeds a lot my procedure time. During the surgery, I don't need to refocus the microscope so frequently due to fusion optics feature that give me a greater depth of field. In the most critical steps of the surgery, it helps me not distracting with the foot switch all the time, focusing only what really matters, the surgery itself. Epinucleus are also aspirated by the phaco tip. When I aspirate the cortex, I prefer to use the hurricane technique with a 30-degree coaxial IA. Provel 8 sometimes surprises me when observing some details in high magnification. Posterior capsule polishing is mandatory because we actually see the cortical remnants attached to the posterior capsule. In this case, I use a BSS flush with hydrodissection cannula to gentle clean it. I prefer to mount the IOL under the microscope, and this microscope really speeds my workflow with the quick focus feature. With the IOL already positioned inside the capsular bag, I perform the aspiration of the viscoelastic and the incision's hydration. The level of detail is amazing, and we can visualize anatomical structures with ease, including the zonules. This is another happy patient thanks to development of the current surgical technique and help of the industry cutting-edge technology.